Warm greetings from the High 10. It is Everyday Shenanigans on this Sunday, March 22nd, 2020. Just like to talk to you guys about the current pandemic that is plaguing the U.S. and abroad. And it's a sad day in this world that we have now had to come to staying indoors if possible. And I'm praying for all of you out there, those of you who are watching and those of you who, are not watching. I'm praying for everyone out there. I'm praying that no one else gets sick and passes away from this deadly virus. I wanted to bring you some information pertaining to the area that I'm in, and I'm sure it's similar to storylines across the U.S. and abroad. But right now, I was going to bring you a little information pertaining to the state that I live in, which is Tennessee. And this is by the Tennessean if you need verification for the storyline. And it was updated 2 hours ago. And it's 9:02 p.m. here. Okay, let's see. Despite coronavirus outbreak, Tennessee governor won't mandate business closures. The novel coronavirus, COVID-19, is a pandemic. Reported illnesses range from very mild to severe, including death. Agencies anticipate widespread transmission will occur in the U.S. in coming months and recommend social distancing, among other measures, to slow the spread. Call your doctor and stay home if you are sick. Get more information at cdc.gov, coronavirus, or contact the Tennessee Department of Health coronavirus information line. Okay. They basically were saying there was a correction on the storyline, that a previous version of the story had been updated to correctly reflect Senator Jeff Yarborough's stance on a possible shelter-in-place requirement. Update. On Sunday morning, Governor Bill Lee issued an executive order closing fitness centers and limiting all bars and restaurants to takeout and delivery services. Tennessee Governor Bill Lee said Friday he believed businesses and churches that continue to draw crowds may worsen the spread of coronavirus. But unlike some other governors, he won't order the closure of these gathering places, at least for now. Lee said his goal was a tremendous balance between protecting the public and allowing businesses to stay open to preserve the economy to the degree that we can. Lee has also recommended but not required the closures of schools. Mandating the closure of a business means mandating the elimination of a paycheck for hardworking Tennesseans who have families and obligations to meet, the governor said. It's a very serious thing to mandate the closure of a business. Although Lee said his administration's approach to the virus would largely avoid government mandates, both the governor and state lawmakers stressed the fluidity of decisions in the face of the fast-spreading virus. Lee said decisions change daily and nothing is off the table. Coronavirus, or COVID-19, is a pandemic that began in China but has now spread throughout the United States, transforming the American way of life in a matter of weeks. Public officials across the nation are taking unprecedented steps to prevent the spread of the virus, including asking and ordering residents to stay in their homes as much as possible. In Tennessee, the state health department has reported 228 known cases of the virus as of Friday afternoon, and those numbers are all but guaranteed to rise. Nashville health officials said Friday the city had 110 cases and gained 50 cases in the prior 24 hours. Medical professionals insist the best way to slow the spread of the virus is for Americans to stay in their homes and minimize close contact as much as possible. Anywhere that draws a crowd, including businesses, churches, and airplanes, should be avoided. Lee echoed this message on Friday, insisting that it was up to individual Tennesseans to do their part to contain the virus. When asked specifically about churches that continue to gather in spite of the virus, Lee, a Christian who often speaks about the power of prayer, encouraged churches to worship without gathering face to face. Churches that continue to meet and gather with elderly and putting groups of people in the same setting, they're risking people's lives, Lee said. There are ways to worship and there are ways to serve without congregating people. Other governors mandating closures. Lee's stance on closures spotlighted the divide between how his administration and other governors and city leaders have responded to the virus. Moments before Lee's comments on Friday morning, Nashville Mayor John Cooper announced plans to restrict all Davidson County restaurants from providing dine-in services. Although customers would be barred from eating in restaurants, Cooper encouraged takeout as much as needed public service. Governors in Ohio, Alabama, Nevada, and other states have ordered closures of non-essential businesses, and the strictest precautions have come from California, where Governor Gavin Newsom has issued a statewide shelter-in-place order. Lee isn't the only Tennessee leader to be wary of these most drastic steps. Senate Minority Leader Jeff Yarbrough, D. Nashville, said he believed mandatory closure of non-essential businesses were overdue, but was hesitant to call for order to shelter in place. And that is the said information by the Tennessean. Oh, there's a little bit more, okay. Yarbrough says such an order may be the right decision for Tennessee, but he was not yet convinced. I think we need to be willing to put our previous positions aside, liberal, conservative, Democratic, Republican, the way that we walked into this crisis. We need to put that aside right now and figure out what is essential to do to keep people safer. And that's the Tennessean. Sorry about that. So other states, I guess, are trying to have mandated protocols, such as California, wanting non-essential places to be open. Their governor there. And as you see, Tennessee will probably do a lockdown tomorrow on said places. I saw a gym was open today, out in the county, outside of Knox County. And so, obviously, they didn't care, because I had to step out myself briefly. It's really the luck of the draw. It's the matter of the toss of the coin, the roll of a dice, if you'll get infected or not, because this disease is airborne, and naturally, if you're not covered up from nose to mouth, ear, washing hands fluidly, wiping down everything you buy, touch. I walked out with gloves on, but I didn't cover my face. I didn't have a mask, and I wanted to wear a scarf, but then I thought, do I want to wear a scarf around my mouth? So I just leaned on faith in that area and prayed about it, and just scrubbed down when I got back home everything I bought, and wiped down all my surfaces after I put everything away and threw things in the garbage, such as boxes or whatever the items I bought came in. But I want to give you an update on some people who have been who have contracted this COVID-19. As most of you have probably heard, Senator Ryan, Kentucky senator, has contracted this virus, and Harvey Weinstein has contracted this virus. And I'm going to give you some said information pertaining to Harvey Weinstein, if you don't mind. Okay. Harvey Weinstein turned 68 years of age last Thursday, and he has been diagnosed with the COVID-19. He is isolated in the Wynn Correctional Facility in Western New York. He is believed to have been positive before entering the Wynn facility, and he is one of 2 inmates that have tested positive at the facility. He left Rikers Island last Wednesday and has been taken to this new place, this new facility, the Wynn facility, which is a intake for new inmates. And inmates are sent here for medical and security concerns that are assessed. Okay, there's been no comment from Michael Powers, who's the president of the New York State Correctional Officers and Police Benevolent Association, on Weinstein's current situation and or health record due to privacy rules. Excuse me. Powers says that the union has urged state correction officials to immediately suspend all non-essential transfers of inmates from one state facility to another, as well as the transporting of local jail prisoners to the state prisons during this ongoing health emergency. The Department of Corrections has also suspended visits to prison inmates as to counter spread of this virus. 3 state correctional officers have tested positive, and they have been, the others have been closely monitored, who came into contact with these 3 state correctional officers. And that is the latest information. So we have a senator, Kentucky senator, that has been diagnosed with the virus, tested positive, and Mr. Harvey Weinstein, the notorious Harvey Weinstein, has been diagnosed. He and another inmate, and now 3 correctional state workers have been diagnosed. And I'm wondering if they were at that same location. I'd have to double back on that. But as you see, I never even thought about that. People who are incarcerated in jail and prison, there's no isolation there because nobody can just, get a private room of their own. So you see, it will multiply and multiply this heinous COVID-19. And naturally, it's a flip of the coin to say, go out, don't go out. It really depends on your lifestyle, your finances, because some people work, some people are retired, some people draw Social Security, some people don't work. I mean, they're all facets of this situation, of this thing called life. So if you have to work, you have to go out. At some point, you're going to have to buy things for your home. Everybody does not stockpile their house up full of goodies. Everybody can't afford to stockpile their house. Everybody don't have room to stockpile their house, their apartment, their shed, their barn, whatever they live in. You get my point. And the fact that some of you have gone cuckoo for Cocoa Puffs, buying up everything out of the store, you are so greedy and ignorant that is sickening. And I was in a bad mood today because somebody just really teed me off with their personal opinion about me needing to go out to the store and blah, blah, blah. My thing is I'm grown. I do what I want to do. I mean, common sense will tell you I don't want to get sick. Why the hell would I want to get sick? But life doesn't stop. You still have to pay bills. You still have to go outside the door for something, be it the trash bin, be it the mail. You have to check your mail. Did you not think somebody's touched that envelope that came to my mailbox in my name? Somebody put that letter in there. Then I got to open it. Same thing with receiving packages to your door from UPS, blah, blah, blah. Somebody touched that package that dropped the package at your door. Somebody packed the package in a package. Just nonsense. The people thinking that you're not going to get affected by something. You're going to, because you've got to go outside at some point. You got to go to the mailbox. You got to touch something. Now, unless you're going to wear gloves outside of the mask, to each its own. But the point is, I don't want to get sick. But if I have to go out to buy something for my livelihood while I'm in this box, then so be it. Be it hair products, food, sugar, milk, whatever. Why would I do without essentials? Because there's a deadly disease outside. It's like, why would I even have to explain that to somebody? Why do I have to explain to somebody what the hell I need out in the store? And what you do at your house or how you live at your address, it don't have nothing to do with Big Ange. You understand what I'm saying? I was aggravated today because it's like, why should you have to explain to somebody what the hell you need for your livelihood? And since somebody want to get smart and quit with me, hey, went to the Dollar Tree today. Yeah, I'm on one. Because all this buffoonery with this stockpiling items is stupid. And it's ignorant and it's disrespectful to people who also need items. No sinus medication. When I went to the Dollar Tree, I go there to get my sinus medicine. None. Listen to me. Reaching back, pulling boxes that have fallen over to check to see if maybe somebody knocked some over. None. I didn't even see bottles of aspirin. If they were there, I didn't notice. Few boxes of ibuprofen, some tension headache medicine, but no sinus. I mean, these crazy nuts bought up every box of sinus medicine. And I had said that to my friend Mel. What next is it going to be that they're going to go buy up out of the store? First it was the toilet paper. Then you're hearing stories about baby wipes. Next will be paper towels and paper napkins. Then it's going to be what? I was just trying to figure out what's next that they're going to find on the list. Soda pops. Getting jiggy over cans of Mountain Dew. I don't care nothing about no Mountain Dew. Yeah, I said it. I don't. That's not my preference of a drink. And it sure in hell ain't my preference to go pile up a buggy full of Mountain Dew. If I was to think of something I wanted to put in my buggy, a whole bunch of drinks, Mountain Dew wouldn't be it. Don't care for it. If you do, that's your business. But what I'm saying is, where does it stop with what people are going to buy up in droves? I live in Tennessee. This is the worst state for sinus trouble, acute sinusitis, which I have. So I needed that. Ordering online and all that, that ain't my bag. I'm old school. I go in and buy what I want. Want to pick it up, look at it, want to see that it's in the box. That's how I roll. This is ridiculous. This overspending, overgouging of buying items is ridiculous because there are other people that live in your area that need to shop, and it is not fair for people to have to go out and drive and waste their gas going from store to store trying to purchase items that they need. And I don't care if it's sugar, milk, food, toilet paper, paper towels, baby wipes, lotion, shampoo, headache medicine, Band-Aids, whatever it is. Damn, be respectful to think that somebody else needs it. I mean, I'm just keeping it real. And at some point, people will have to go to the store. I don't care if you put off going to the store today. At some point, you are going to run out of something in your house. I don't care if it's a bottle of ketchup. You use the last bit of mustard. Now, one could say, well, you really don't need the mustard. You really don't need the ketchup. You really don't need that Mountain Dew. You really don't need that hair perm or that lotion or that. Hey, to each its own. Real talk. The point is, you're not going to be able to stay in your house. Most people have a job which requires them to show up. Their job has not closed down, and we know that in the real world, you cannot just close everything down. Schools, businesses, restaurants, because then now these people will have no way to pay their bills. They will not be able to have a place to sleep. So besides you having the coronavirus eating up people's lungs, then you'll have people homeless on the street because their job closed. They could make enough money, find another job that would be open so they could pay their bills. So now you're talking about another pandemic of people wandering the streets with nowhere to live and being evicted, or not being able to pay their light bill or the gas bill or their rent or their mortgage. So you see, it goes way deeper than just getting sick. This is a serious situation, and people need to be more mindful of people's feelings. You need to be mindful of how you talk to people, how you speak to people. The gouging and the of items and buying things in droves that you really don't have to have. Now, I know everyone's tastes are different as far as what they like to eat, what they like to drink. But hey, you just can't think you're going to walk into a store and buy 20 things of Dr. Pepper, Coke, or whatever. 12 cans or however many come in the pack. You know, be serious. And before there was this pandemic, if you went to Kroger to buy Cokes that they were on sale, they only limited you so many of those Cokes to purchase, even then, when there was no coronavirus or knew of coronavirus. So you need to think and be respectful of other people who also want to eat, want to drink, got babies. The babies need formula. The babies need Pampers. The babies need wipes, toilet paper, baby food. It's all the same. Whatever it is, your vice of choice that you feel like you just got to have an enormous amount of whatever. I was looking at Ikamel's channel last night, looking at the crazy woman in Florida loading up her truck with all that boxes of toilet paper out of the Dollar Tree. Those people at the Dollar Tree need their tails beat. Whoever allowed that crazy woman and that man, whomever, to load up all those boxes of toilet paper, you're foul and rank. And I think you're in cahoots with them, because why would it take 2 automobiles to load up boxes of toilet paper? You had to been down with these people. And you thought it was okay to let that massive amount of toilet paper to exit the store when there are thousands of people out here trying to live and survive just as you are. And anybody that runs a store, clerk, manager, third key, fifth key, whatever you want to call it. You a foul if you let somebody come around the back of that building and exit out of there with boxes of anything. I don't care if it's diapers, toilet paper, soda pop. You're fouling your rank. And let me tell you, what goes around comes around. And some of you better check yourself. Because you think it's okay. You're going in the store buying up all these drinks and toiletry items. You liable to sit there and choke right there on your Dr. Pepper, your Mountain Dew. Because you were so greedy, gluttony. Couldn't wait to get that soda pop, knowing you can't sit there and drink up no dang 4 or 5 cases of drinking or sitting. And I'm keeping it 100. And as far as telling people what they should and shouldn't be doing, best we all just keep our mouths closed and be quiet, because we all know that in the end, we will have to go outside the door to purchase something. Maybe not necessarily go to church, necessarily go hang in a bar, a party, a large gathering. But you're going to need something. You're going to have to go out for something. You may have to go in person to handle a personal matter, a bill. Grown folks' business. And nobody can tell you, don't worry about it. The coronavirus out there. Well, Corona, last I checked, that heifer ain't paying nobody's bills. She ain't paying nobody's car note, electric, gas, food. She's just swarming the air, eating up folks' lungs. That's what she's doing. Yeah, it's a she to me. I'm calling Corona a she. Just be respectful of people. Be respectful that nobody wants to get sick or die from this virus. Nobody wants to be quarantined in their home day after day if they don't have to be. But they do it if they feel like they want to try to stay alive. Be respectful of people's livelihood, children, daycares, all that. Because this will affect us one way or another. The economy, it will affect us. And it may cost us to be right where we were back in 07, 08 when the economy fell. And things went up, the prices of things went up, the gas went up. So if you're sitting here thinking it's cute, buying up everything in the store, just imagine the day when you can't buy anything. The doors of the church are closed. The doors of the stores are closed. And it ain't buying nothing. You ain't getting nothing. And let's see what you'll do when you can't get your 10, 12 packs of Mountain Dew, 20 boxes of toilet paper. What you gonna do? Break the windows out of the store? Shoot the store open? What you gonna do? I'm just saying. You want to get ignorant. You want to talk crazy to people, curse people out because you know you foul what you're doing. You might need to think first before you open your mouth. Think about your actions and think that there are other people out here who also are in need. This is Everyday Shenanigans. Thanks for joining me. You all stay safe out there. Stay warm. I'm praying for all of my fans. I'm praying for everyone in the U.S. and abroad. And I'm praying for a cure, a vaccination, something to help knock down this virus. God bless you. Like, share, subscribe, drop your comments below. And until the next video, this is Everyday Shenanigans. Thanks for listening.